Hey, welcome everyone. My name is Darren Ho, and this session is Geographical Considerations for Combo Prevention. We have 2 hours together, so as we're all aware, there's been some slight changes into our schedule. The schedule says that this goes until 3:30, but we're actually going to go until 3:45. So we have a good 2 hours to listen to 5 amazing panelists. I'm going to introduce each one one at a time. I'll introduce one, they'll speak, and I'll introduce the next one. Other than that, I'm just going to get started. The first person I have the pleasure of introducing is Kim Kinakin from the Living Positive Resource Center. Kim Kinakin is the coordinator for the Men's Health Initiative located in Kelowna, BC. MHI is a nonprofit dedicated to the health care needs and concerns of guys who like guys throughout the interior of BC. Please welcome Kim.
Thank you, Darren. Thanks for everyone for coming out. I hope you're not all in a food coma like myself after lunch. And I will try to talk slower because I sometimes get talking fast, but I have lots of slides, so I'm going to be doing a little balancing back and forth. Just to give you a quick recap for those who don't know about the Interior Health Authority, the region of the Men's Health Initiative, it mirrors the Interior Health region. So up in the top right corner here, you can see all of British Columbia and see that it's the second largest health authority by geographical space. And this really brings up to some of the challenges of the program, because even though we're focused in Kelowna, in the center of the interior in the Okanagan, there's still a lot of geographical considerations of mountain passes, especially as winter, and as many of us know right now, the Coquihalla was closed last night, so when we travel, we have to be wary of that. So there's challenges of people accessing healthcare in the region as well because of that. Our Interior Health region has 54 First Nations communities, and I would love anyone who has connections with the First Nations communities in Interior Health to connect with me to partner, because it's one of the areas I would like to see grow in our program, and that I don't have as much stats to add to this presentation. So many people say, I don't see many gay men in the interior. And a part of that background with the history of this area is that folks historically who were out or visible would leave the interior and go to the big city centers. And the stats kind of show that, with the Interior Health representing 57% of people in that area that identify as gay, as the lowest of all the health authorities, and also the highest is identifying as bisexual. And in the interior region as well, there's 41% of men are not out to their healthcare provider. So when you add some of that together, especially with the stats around the Sex Now survey, saying that folks who aren't out are 10 times less likely to get tested, we kind of got this recipe of how do we reach this large population that need to get tested that aren't getting tested. As well as we have 24% reporting condomless sex, 47% reporting not being tested for HIV in the last year, 19 have never even tested for HIV at all. And the combination prevention model, in the last studies, it was 48% were unaware of PEP, or 50% unaware of PrEP. As I was saying, there's a limited history of those who are in the area, but there is emerging communities are coming through. We have 2 universities in the area, UBCO, thank you, Darren, and the Thompson River University. While the majority of the labor market is more blue collar, there is a lot of emerging tech jobs coming into the area. So we're seeing lots of young people moving here from city centers where it's more expensive, looking for services that they're used to, and we're not actually necessarily having all those services they're used to. So this is the entire province, and looking at the stats of MSM for new HIV diagnosis in BC. So the average is 51% across BC. And when we look at the Interior Health region itself, it's 35%. It kind of gives you an idea of what our need is, and when we're looking at a lot of the services that we have, a lot of times we're not seeing services directed towards men who have sex with men, yet our stats are showing that we clearly is a need. This is the saddest of the stats that I have on our area, and that is in the provincial health report that came out in 2012, when looking at the different health regions, They have the numbers, of course, of how many people were testing positive in each region. But the farthest right column, if you can look at, in Vancouver, coastal health people, there's a 7% chance of those people who are testing positive to have advanced HIV. When you step out into Vancouver Island or to Lower Mainland, it almost doubles. When you get to northern and interior health, it's 5 times greater. You have a 35% chance of testing not just positive for HIV, but for advanced HIV. And that is just a ridiculous stat to add to the stat we had before. So a great need for testing. Some of the history, which is in this room as well, I want to add, of where the Men's Health Initiative came into place was in 2008, there was a report to look at the needs of men who have sex with men in our region, and there was a disconnect between folks who felt that they didn't feel comfortable being out to their service providers, healthcare providers, and the healthcare providers were saying, we don't have any MSM to patients to deal with. So to respond to that, a project was created at the Living Positive Resource Center in Kelowna called Engaging Physicians to bring up that dialogue. From that, the reports and the findings that came from that, funding through PHAC was created to create the Men's Health Initiative. I have 2 of my predecessors here, Jazzy and Dylan, who worked on the program, and there was also Kevin Sayamore worked on the program. We are now in our 6th year now, going to our 6th year as the Men's Health Initiative. We've created some documents through our history of looking at the needs assessments of the area, as well as talking to our membership. We had 2 different events, a gathering and a gathering, and that really directed the program as being membership driven. And we rebranded this year the whole organization to represent some of the diversity of our membership in the program, and using the term guys who like guys. As I mentioned in some of the previous stats about that, it was that having one term, whether it just be gay men's health, or it was like actually there's a lot of different identities in our region, and just kind of focusing on guys who like guys and having a tagline that includes however people want to identify with the program. We let that people identify how they need to identify, want to identify, and as long as they kind of find allegiance with guys who like guys, that's how we work with the program. The priorities coming from the membership were education, testing, fun, which actually turned into safer spaces because through the information of the membership wanting to have fun events to do, they realized there's a lack of safe spaces in the interior region. There actually is no brick and mortar gay services or community services that exists. We also focused, one of the priorities were prevention, harm reduction, outreach, and research. So the MHI has created some volunteer committees. The advisory committee that helps direct the program more, I'd say more focusing on long-term goals and more boots on the ground is our art and design committee, our communication and outreach committee, research and advocacy committee, and social events committee. These are some of the events that we put on. Through the art and design committee, Ben and myself, Ben's here right now, who's come up with some of the fabulous designs we get to work with for our last gathering, an example of our prick event, which I'll be talking about, and then one of our social events, Fruit Float, that happened this last summer. So sexual health and STI testing in the interior. So this is probably hard to believe for a lot of people in other health regions, but in 2012, Interior Health decided that it was not cost effective to have STI clinics, and they shut them all down. This actually means STI testing services does not sit on anyone's desk, and was intended that people go to see their doctor or their healthcare provider, walk-in clinics, and to have other services pick up that demand. Options for Sexual Health pretty much has always existed, and they have many different locations. They're a nonprofit. They didn't always focus on STIs. They were more of a women's reproductive health organization, previously Planned Parenthood. They have seen incredible demand of people looking for STI testing at their locations. Interior Health did create the Stop HIV, or adopted the Stop HIV program in 2015 fully. And with their project, even though the mandate is to add HIV testing to STI testing, it's kind of become a backwards model where they've been adding STI testings on top of HIV testings. And it's created a real limited amount of resources for them because of the time constraints it is to take STI testing tests as opposed to doing point of care for HIV. So one of the other services that exists in pilots right now is in Kamloops and Nelson with the Get Checked Online. And the Interior Health created the HIV on Demand and the Okanagan. The Get Checked Online is full STI screening options for people to get that done at home, and they print it up, and then they can go into a lab and get their results. The HIV on Demand is specifically just HIV in the Okanagan, so there's not an integrated system for online STI testing in the interior. It's still piecemeal at this point, though there is talks about expanding that. Just trying to look at that because of the limitations. And so there's a lot of limitations about people getting STI testing. So we do have those who have the privilege of being able to travel. We do see a lot of guys who go, I'm just going to go to the cities, whether it be Vancouver or Calgary, to get their STI testing needs met and then come back. Of course, they would rather be able to have something local, but those who are local and don't have that privilege of being able to travel, there are no specific MSM services that they can receive. Until we created PRIC. So last year and 3 months ago, following from the membership of having an MSM-specific testing event, PRIC was created. The idea to actually work with some of the clinics and have a night that was promoted specifically to our audience. PRIC is a full STI testing. We didn't want just HIV testing. We wanted to make sure that while we're getting guys, that they're getting all their sexual health testing needs met. And it's in Kelowna is where we started the project. The Men's Health Initiative is pretty much the face and the marketing behind the event, where options for sexual health, they already have the infrastructure to have the event. They do it twice a week, and it works out of an interior health space, but they provide the volunteers. They have the booking line for people to make appointments they want in advance, and again, of the volunteers to run the paperwork side of stuff. And then interior health comes along, and we get their stop outreach nurses to actually do full STI testing. And it's held at the Rutland Aurora Health, which is just outside of the center of, it's outside of the center of Kelowna. It happens once a month. We basically go into the spaces and guy it up, is what I say. We have volunteers that are the greeters. We have posters that we put up. We try to have some magazines around, information that is directed towards our membership. Sometimes that's making sure they can get a rainbow sticker to put on the door and just helping make sure the space is sex positive for MSM. As you can see, here's examples of our spaces. Our volunteers are key to this, not only in being the faces of the event, but decorating it, putting it together, and creating the energy of the space. It really transforms some of our events where pretty much it's otherwise, I would say, a women's reproductive event is what normally happens at OPT. We turn it to the guy event and add a social aspect to it. Focusing on the marketing and promotions, which is our responsibility. As I mentioned, we rebranded the whole organization, program I should say, and integrated our social media with our website. So our events that happen on our social media pages are linked up to our events calendar, and anyone goes on the website can see what's kind of going on in whatever their region is, because we focus on the interior. And we do a monthly newsletter as well to keep people informed about our testing events, but also the other social events that are kind of going on that basically help create the community that we're creating. Our online partners to help promote that are Get Checked Online, My Health is Sexy. We also have some local media organizations, Castanet in the Okanagan and Basanti, which actually provides these LCD advertisements in businesses. Smart Sex Resource, we also promote on that, Craigslist, and the Pacific AIDS Network newsletter. And then we have posters. We print up about 50 to 100 posters. We were able to get a grant through the Kelowna General Hospital to be able to print the posters. And our volunteers put the posters up throughout the universities and through some of the businesses in the Kelowna area to help promote it. We, on our posters, make a big point of connecting with community partners. they're not sponsored with financial aid. They just actually, we provide their logos on our posters to really create a sense of these are the community connections that folks who are interested in this night can resource, and to get some community buy-in from those organizations for the event. Mention activism because while social media postering is really a great way to be able to get stuff out there for free, putting the posters up in the physical spaces of Kelowna has been a form of reclaiming the public space with a MSM gay bi focus. It's not many things that you'll see in the Kelowna street area that are promoting services like this. So in many aspects, I see it as activism, just putting posters up promoting these prick events. Here's some of our volunteers and folks and our business owners who take space up for us to make sure that we can put up our posters, whether it be in bookstores or coffee shops. Wine and Art is one of the queer-owned spaces that's actually no longer, but as well as our partners at Okanagan College have made it possible for us to be able to put posters throughout the campus, as well as our Pride Resource Center at University of British Columbia, Okanagan. So definitely we focus a lot on the young students in that area. These ones are a bit ahead of the game because I'm showing you some examples of some of our promotions with some of our partners where we actually have been able to promote 3 months in advance. And I'll get to this point of being there because in the beginning we were only given one event at a month at a time. Sometimes I wouldn't even know if there was going to be the next month. Oh my God, this is, all right, squishing in way too much in here. We have frequently asked questions and surveys that we put out at our events so that we can get feedback and actually direct the program, and also provide information for people who are in the waiting room wanting to know more about what testing events, what's going to be provided for them, how confidential it is, and what other ways they can be connected. These are our community partners. It's a big concept of what I call building community and using and utilizing and promoting them. So these are going to get some of the statistics. So on the far left there, that was a regular average of guys coming to an opt clinic. So this is the information I use to actually promote or to present to Interior Health to be able to actually get 10 months of funding. When I say 10 months of commitment to being able to do the Stop HIV nurses to be able to provide the testing. As you can see, in the 7-8 months that we presented this, we tripled and quadrupled on some of our events and sometimes had to turn guys away because there was just too much demand for people to coming and not enough nurses to be able to actually do the testings. And when I show the one in the middle there, which is one of the highest numbers, I have to say kudos to our nurses who stayed till like midnight when we were supposed to be closing at 9 o'clock because they wanted us to get these numbers to prove to Interior Health that we had a need. So that's just giving a breakdown of how many guys of MSM to straight guys that showed up or guys who didn't identify as MSM confidentially or privately. There's a need in men's health for testing. So guys who didn't identify the program still felt they were more comfortable to come to our event than to come to a regular testing event. This is a comparison of hours of our Interior Health nurses putting into a Pride events, because we've done outreach testing at Pride events, compared to our prick events. And as you can see, we have way more testing of guys compared to the hours spent by the nurses, so it's a real good investment in reaching guys. So we've got the 10 more events happening, so it's great. We can do some future planning now and being able to do advertising campaigns like I mentioned earlier, or showed you earlier. There's one with squirt.org. I couldn't do that before because I never knew how much time I had to do the next event, but haven't been able to actually analyze that data yet. There's definitely opportunities for us to grow because our partner, Options for Sexual Health, has 25 locations in the Interior Health region, so they're a really good partner. They don't have the support to do the testing for us, so having the support of Interior Health is going to be really crucial for us moving forward. And the problem with that is Interior Health closed it down. They've done an internal audit, and they've noticed a need for the project for testing, but at this time they still need more numbers to prove that it's actually feasible. So I think there's lots of opportunities with prevention, combination prevention, and that there is no other model that we have right now that reaches MSM besides our prick event. And when we're looking at how would we expand it to include PrEP, we are creating some of the foundations for that through this project. And with this presentation, we got the 10 months more, but also Penticton had the similar partnerships. And so now we've been doing it in Penticton, and we've had about 8 testing events in Penticton. We've had interest in Kamloops, but again, they don't have an options for sexual health, so we've had some logistics in parachuting it out to other locations. And we hope to expand to Vernon and Nelson in the next 3 or 4 months as there's interest and desire to do that. So yes, I think that's pretty much it for me.
Thanks.